Everybody, we have a great show tonight. We're going to talk about should you avoid gluten, even though you may not have any gluten issues. We'll talk about post-COVID GI issues. What is going on? Are people having a lot more gut issues after getting COVID-19? We'll talk about should you eliminate fructose, and we'll talk about the proper way to wipe your bottom and your live questions in today's Poop Tip Tuesday. Guys, let's talk about poop. Hey guys. My name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right guys, we have a great show today. I'm excited about today's video. I hope you guys are doing well. It rained like crazy yesterday in Lubbock. We lost power for a couple of hours, but lucky it came back on, and I'm on the live stream. So I hope you guys are having a great day. We have a great show today. So a couple of housekeeping tips. Number one, if you can do me a huge favor, if you can smash that like button, like, share, and subscribe on whatever social media channel you are watching. And number two, I'd love to hear where you guys are watching this from. Are you watching this live or on the replay? And where you guys are watching this video on as well. Nita's good seeing you. Amy's good seeing you. Angela's good seeing you guys as well. Thank you guys for watching on the live stream. Also, let me know any live questions you want me to answer. We'll answer them in today's Poop Tip Tuesday. We have a great show. I'm excited about what we're going to talk about today. So question number one. So hey, Dr. Islam, should you avoid gluten even though you don't have any gluten issues? Well, great question. If you look on the internet, gluten seems to be the cause of everything, whether it's gut issues, whether it's hormone issues, whether it's brain issues, whether it's heart issues, whether it's what's going on in the world, gluten is the root cause of it. Oh my goodness. So let's get down to exactly what's going on. So gluten inherently is not, there's nothing bad inherently wrong with gluten. No matter what anybody tells you, there's nothing inherently wrong with gluten. It is fine. There are thousands and millions of people who eat gluten every single day and don't have any gut issues. Not a big deal. And a lot of people can have gluten and not have any significant problems. There are a subset of patients who actually maybe could ingest gluten and really have some really bad gut issues, especially if you have a condition called celiac disease, which is an autoimmune disease in which your body attacks itself whenever it ingests gluten, and that can cause really significant damage. Or if you have a condition called non-celiac gluten sensitivity, in which you're sensitive to gluten. But by and large, gluten is not a dangerous substance to eat. No matter what anybody tries and tells you, if you look at the clinical evidence, there's nothing inherently wrong, nothing inherent inflammatory about ingesting gluten. In fact, the most common reason why people have gluten issues may not be the gluten itself, but ingredients in the gluten, specifically FODMAPs or fructose, which we'll talk about in a future video as well. So gluten in general, nothing inherently wrong about this. Don't fret, don't freak out, not a big deal. All right, Joyce, good seeing you. Thank you for watching. Carol, it's good seeing you as well. And Freddie, it's good seeing you guys as well, guys. Guys, perfect. Thank you guys for watching on the live stream. All right, so let's see. So Taz, good question. I'm going to answer this right now. So, Dr. Islam, why does wearing bras or high-waisted jeans or pants give so much gut issues? Burping is a discomfort. Absolutely. So, this is actually a very common problem that people have when it comes to gut issues are the clothes that they're wearing. So, tight-fitting clothes or clothes that are high-waisted, maybe even bras, can put pressure on your abdomen and your diaphragm as well. And that pressure will close off what's going on inside that stomach to make it more likely for you to have maybe indigestion, acid reflux, and burping. You just have a smaller diameter than what your body can work with, what it's used to. So normally when we eat, the stomach will do what's called a combination. It will actually expand a little bit to allow the food to come down and settle inside that stomach. But if you're pressing on your abdomen, either with tight clothes or maybe a tight undergarment, that's going to decrease that inability to relax. And because of that, you may have worsening gut issues. It's a very common problem. So an obvious fix is to not wear tight clothes if you're having issues with bloating, distension, gas, and things like that. Great question. All right. Sean, it's good seeing you, and Paul, it's good seeing you guys as well. And KB, it's good seeing you guys as well. Thank you guys for watching on the live stream. All right, perfect. So let's answer question number 2. Hey, Dr. Islam, I've seen a lot of people have gut issues after COVID-19. Is this real, and what is going on? So absolutely 100% this is real. I see this in my office, and we are seeing this pretty much nationally. We're seeing this rise of what's called functional GI disorders after COVID-19. What could be going on? We don't quite know the pathology about what is going on. It could be that the virus attacks certain cells that are more prone to be in the small intestine. Maybe the stress of having COVID-19 is causing worsening gut issues. Maybe something else we're not quite aware of, but we know a lot of patients are having worsening diarrhea, constipation, bloating, and heartburn, things like that. Now, there's no particular really magical way to treat our patients who are getting this condition. It really is basically treating the same way we would normally treat somebody. So if somebody has bloating, well, we try to figure out the cause of that bloating and get that taken care of. If someone is having diarrhea, we get down to the root cause of that, and we treat it the exact same way as somebody who may have other causes for diarrhea. Same thing with constipation as well. But it is a very common problem that we're seeing a lot of patients after COVID-19 to have a lot of gut issues going on. And we are actually getting this rise, this flood of patients coming to see us because of this issue. I pretty much treat this every single day in my office of people who've had COVID-19 months ago. They are still having gut issues even after the fact. A very common problem, very good question. All right, perfect. Abdul, it's good seeing you guys as well. Thank you for watching on the live stream. All right. Angela, good question. So, Angela asks, I see commercial and pamphlets at my PCB's office about doing a stool sample to check for colon cancer. What are my thoughts? So, you may be talking about the Cologuard. So I actually have a couple of videos on the Cologuard. So let's talk about this. So a Cologuard is a test that actually checks for stool DNA or abnormal stool DNA inside your butt, inside your colon, inside your stool. And so certain conditions like a large polyp or a precancerous polyp or even cancer will secrete out abnormal DNA, which we can see in the stool. And the Cologuard is a test for us to see this. Now, the Cologuard is an okay test. It's not the best test, but it is recommended for those people who just absolutely, who say, I do not want a colonoscopy. I will never get that done. I don't want to see what's going on. I don't care. Now, the things I typically sometimes worry about are what I call the false negative rates of Cologuard. Now, the Cologuard test is not 100%, accurate. There are some patients who've had a normal Cologuard, a negative test, who end up having something going on inside that colon. And vice versa as well. There are patients who had a positive Cologuard, but nothing was seen in that colon. My recommendation is to always, always, always do a colonoscopy for a couple of reasons. Number one, we can see what's going on, but at the exact same time, we can fix it. Number two, if you're doing a colonoscopy for a screening purpose, meaning you're not having any symptoms, it is typically covered by your insurance. And number three, a normal colonoscopy gets you clear for 10 freaking years. Whereas a Cologuard, a negative test, only gets you clear for only 3 years only. And once again, the best way is for us to actually physically see what's going on and remove what could be causing the issue with the colonoscopy. And the colonoscopy is the only way to do that. With a Cologuard, if you have a positive test, the next thing you have to do is a colonoscopy to find out exactly why it's positive and then fix it at that time. And so we want to make sure that if you can get it done and get it out of there, you don't have to worry about this ever again. So my recommendation is to do a colonoscopy, find out what's going on, actually allow me to see and fix the problem that you may be having. Great question. All right, question number 3. Hey, Dr. Islam, should I eliminate fructose? All right, so if you've seen my videos in the past, I am a big enemy when it comes to fructose. People don't realize how much fructose is in so many different types of foods, whether it's ketchup, mayonnaise, even bread. And I mentioned this before, for people who have gluten sensitivity, it actually may not be the gluten that you're sensitive to. It actually may be the fructose in a lot of gluten-rich foods. Now, high fructose corn syrup or fructose can cause a lot of sugar and changes in your gut microbiome. There is some evidence it can make you fatter, but there's also more evidence this can cause a lot of gut issues to occur. So my recommendation, if you're having gut issues, one of the first and effective things you can do is try to eliminate all fructose from your diet, whether it's in mayonnaise, whether it's in ketchup or certain breads or any type of condiments or anything. Look at the packaging, read it, see if it has fructose, and consider eliminating that, because I will tell you, a lot of my patients feel so much better when they just eliminate fructose, get rid of that. They don't have to worry about that, and then they can just go about their lives and not have any more gut issues. So my recommendation, if you're having gut issues, consider eliminating fructose, see how you feel, see if it makes things better, and if it does, then all good. Then we're all good there. All right, perfect. All right. Angela, great question. So good. I'm glad you like the colon prep. So you're basically asking, is doing a colon prep on a routine basis safe? The answer is yes, absolutely it is. So things that we use for a colon prep are not absorbed in the body. It's just secreted in the colon. Basically, it's a whole bunch of Miralax, and Miralax is a very safe medication to use consistently. And there are plenty of patients who feel like they need to get it clean out and get everything out. And I will tell you, using a colon prep will do that. It is safe as long as you don't overdo it and become dehydrated. And I have plenty of patients who do this on the occasional basis to get themselves cleaned out, make themselves feel better, and just get rid of everything. So yes, it is safe to do for the most part. Obviously, make sure you speak to your healthcare provider to make sure you can get some labs done. But by and large, it is a safe thing that you can do. Very, very, very good question. All right, perfect. All right, I'm just looking here for more questions. All right, perfect. All right, KB, good question here. Hello, how can we get rid of parasites? I've heard most people have them. Well, KB, I will tell you, if you're living here in the United States or in the western part of the world, the answer is a very good chance you do not have a parasite. Now, there is a very good chance that you will be tested for a parasite if you see some of these kind of, how do I say this, kind of these pseudo doctors who try to do all this stool testing to see if you have parasites and they see that you have them. I can tell you the vast majority of those tests are completely wrong. Unless you live in an area that has a high endemic rate of parasites, if you drink water from the streams, if you go to sub-Saharan Africa or Asia and walk barefoot, if you eat food that are not very clean, you may have a parasite at that point in time. But by and large, if you live in the United States or in the Western Hemisphere, you cook your food, you have good sanitation, it is very unlikely for you to have a parasite, and it is very unlikely for you to need treatment for that. So I wouldn't even worry about that. It's a great question. All right, perfect. All right. Another question that I got. Hey, Dr. Islam, should you wipe your bottom? All right. This goes down to the root of how someone should actually clean themselves. I love this question because this is actually a very common question that I get as your poop guru. How do I wipe myself? How do I keep myself clean? Is there a proper way to wipe? Well, just like fine wine, there is a proper way to drink wine, and there is a proper way to wipe. Let me know in the comments down below if it's something you've actually wondered or not, because I've gotten plenty of patients who've asked me this as well. So here are my recommendations on how to keep yourself clean. Number one, your bottom is a very sensitive area. And so it doesn't like a lot of rough housing. It doesn't like a lot of pressure. It doesn't like a lot of scraping either. And so my recommendation is to not necessarily just wipe hard, but maybe blot the area. Absolutely blot the area. Use that to kind of help clean yourself. Number two, consider adding water as well. Whether you want to add water to your toilet paper to help blot the area or to keep yourself clean, or my recommendation, use a bidet, which I will tell you makes you feel fantastic. This will keep you clean as well. Number 3, make sure you wipe from front to back. And we obviously know the reason is if you wipe back to front, there is a chance you can get bacteria in areas where you don't want it to be as well. And number 4, don't be very vigorous when it comes to wiping because you can cause a tear, hemorrhoids, pain down below as well. And then lastly, I am not a fan of wet wipes. Wet wipes will help strip away some of the natural bacteria and the natural moisture inside your bottom, which can make it more likely for you to have other things going on in there, like a fungal infection to occur. And this may make things a little bit more difficult to treat later on. So in summary, use water, consider a bidet, blot the area, don't wipe hard, and also make sure you don't use wet wipes. These are my recommendations to help clean your bottom to make sure that you have a happy and clean bottom. There we go. My tips for you. All right. So Carol, good question. How often do you need to take magnesium citrate? So it's a very good question. So I would tell you, number 1, it really would depend on how bad your constipation is. I have some patients who take mag citrate every single day. Now the biggest thing is, can you overdose on mag citrate? Well, if you're under the care of a doctor, what we can do is that we can check your magnesium level. And if your magnesium level is normal, you can continue taking the mag citrate. And we would check that on a consistent basis to make sure it's not high. Now, in the vast majority of people who take magnesium, that magnesium will be secreted out into your colon, so you're not going to have a overdose of magnesium. But under the supervision of a doctor, we can check this. So I have some patients who take it every single day. Not a problem for me. I have other patients who take it multiple times per day. But the important thing I want you to realize, Carol, and everybody else, is that make sure you're under the care of a doctor before you start taking mag citrate, so we can check your levels to make sure that they're doing okay and that they're not too high. All right, Paul, good question. Why does burping relieve nausea? Well, this actually may be due to the cause of your nausea. Now, nausea is one of those symptoms that it's very difficult as a doctor for me to know what the true cause is, because nausea can be due to so many different things. Things inside your brain, things inside your gut, things inside your small intestine, things outside your GI tract as well. But if burping relieves nausea, that tells me that something's going on inside your stomach, whether it's an infection like H. pylori, whether it's GERD or gastritis, whether it's small intestinal bacterial overgrowth or SIBO, whether it's heartburn, maybe it's delayed gastric emptying as well. But if burping usually is the cause, that may mean that you may have too much air inside your GI tract, and burping is the only way to release that. And there's different tests that we can do and different dietary modifications I would recommend to help alleviate that as well. Great question. All right, perfect. All right. All right, guys, these are some great questions. All right. Sorry, I'm just going through the list here. All right, perfect. All right, so last week I asked you guys a question, whether you guys would be interested in doing a gut club, so to speak, in which I kind of go into more of a master class for more topics like reflux, constipation, diarrhea, and things like that. And so I am very interested in your thoughts on that, because I am really considering doing this. It may be a special service that I offer to some of my fans who are out there. So if you are interested, please let me know. Comment down below. I'd love to hear what your thoughts were on that. If I get a lot of interest from this, I actually may end up doing this. This may be a paid model just to help pay for some of the workup to get everything done. But if you are interested in doing this, I think I might do kind of more master classes to go into more deeper topics of how we approach heartburn, diarrhea, constipation, bloating, the more common conditions, fatty liver, things like that. And this is something you are interested in, that please let me know. Comment down below. And we may end up doing something pretty quickly, and I'm excited to maybe consider doing that as well. All right. Taz, good seeing you. Thank you for that. Jane, thank you. Perfect. Matt, good. Thanks for watching as well. Awesome. Perfect. That sounds great. All right, guys. Well, I want to thank you guys for today's videos. I'll be staying on a little bit longer. If you have a question for me, send me a DM. Let me know what you guys think. Also, let me know about the Gut Club, whether you think this is worthwhile as well. And as usual, Don't forget to subscribe to a weekly newsletter where you can get great tips every week from yours truly. And if I do end up doing more things on this gut club, I will put it in that newsletter as well. And I would hopefully hear from you guys and see what you guys have to think. Hope you guys have a happy and healthy day. Take care, everyone. Bye, everybody.